strengthening the network of service providers. And we've been able to do that through centralizing our information and assistance program through Community Care Management Corporation. We provide through the area agency a lot of technical support to our contract agencies on a regular basis in both counties. And we've been applying for grants. We succeeded in getting an Archstone grant on fall prevention, and I'll just tell you a little bit about that in a minute. We recently applied for a United Way grant, which we were not funded for, specifically for our mental health outreach services, so we will try again. And we are now in the process of applying for a Caltrans grant, particularly for Lake County transportation, because they really don't have any specialized senior transportation. We have a 4-year planning process, and I'm going to go right through to the needs assessment. Part of the planning process is to do a written needs assessment. And I wanted you to just see a quick summary of some of the demographics of who responded. Go ahead, Letha. That the responses were at least 50%, 75 years and older. We had more female than male, which is fairly common. We were concerned about our low Hispanic and Native American. We did work with Consolidated Tribal Health and Nuestra Casa, but we want to look at some other ways to reach those folks the next time we do an assessment. But you can see a large percentage are on SSI and living alone, as well as relying on someone else for transportation. It's also interesting, we thought you might like to see the Lake County and the Mendocino County statistics next to each other, because there are actually more similarities than there are differences. Go ahead, Letha. We ask in the survey, what is the primary issue of concern for you in terms of being able to continue to live independently? And if you look at the both counties, you will see some, again, striking similarities. You look at the top 10, and you're going to not be surprised at many of these. And you'll notice that in Mendocino County, getting enough exercise, mobility are top issues, as well as in Lake County. One of the striking differences is, I think, the transportation again. Go ahead. Which brings us to the grant that we received from Archstone, which focuses on those issues of preventing falls, mobility. It is a grant through Archstone Foundation. We're one of 10 counties or PSAs, planning and service areas, to receive a grant for building a coalition. This is our mission, reducing the risk of falls. We have formed a partnership. You can see our coalition. We have an exciting coalition with representatives from both Lake and Mendocino County. We've met about 4 times. We are in the process right now of doing a survey throughout both counties of all the medical community as well as service providers to find out what services are in existence now to prevent falls. And from that, we are going to create a strategic plan to address this issue in both counties. For those who are over the age of 65, senior falls are an issue. 1 in 3 will fall. 20 to 30% of those will have a serious injury. And this is nationwide. 15,000 will die per year. In California, it's 1,300 that we know of. Locally, we have some numbers. In Mendocino County, you're looking at a little over 3,000. I have to tell you, this is over a 10-year period. What we're seeing is that the trend is going up. We can look at the statistics annually, and we can see that each year we're increases, which makes sense as our population of older adults increases as well. And of course, we know that many falls are not reported. We know that 94% of fall victims that are hospitalized, they're in the hospital for 7 to 21 days. 48%, almost half of them require long-term care, and this $40,000 average incident cost is a statewide average. We've looked at many different counties, so for each fall where the individual ends up in the hospital, this is the average cost we're looking at. This is definitely worthwhile to try to prevent this. And in fact, what the information is that we have been learning is that 30 to 50% of these falls can be prevented by setting up partnerships such as the one that we've set up in Lake and Mendocino County, and having a sustainable program and building an infrastructure, which the coalition will be working on, because it will take a coordinated effort. What has been proven to work in fall prevention is having a multifactorial approach. We need to look at exercise and activities, balance and strength. We need to look at home assessment and safety. We know that universal design is a very effective method of addressing falls. We need to promote this. Nutrition, diet plays a very important key role in this. Medication monitoring, management, and education is also a key issue. And we've added in our program drug and alcohol. It has control, but really what we mean by that is education. We want our seniors to make educated choices. We want them to have information about the effects of alcohol as well as prescription drugs and when they are mixed. In your packet you have a brochure that we recently distributed in April for Alcohol Awareness Month. We sent that out to all the physicians with a cover letter in both Lake and Mendocino County, and this is being distributed through all the senior centers and the in-home supportive services programs. So we have a conference scheduled next week on elder abuse, it's the Elder Abuse Prevention Coalition has coordinated it, but it is on fall prevention. And that brochure is in your packet. You're invited to join us for that. And there is much work for us to do. We know that our area plan is a step in the right direction. Our strategic plan for the adult and older adult system of care is a step in the right direction. But together, we hopefully will all be able to accomplish what we need to. Thank you very much for your time. Their care is in our hands. Thank you.
You bet. Thank you, Susan. Comments from the board? Supervisor Smith.
Thank you. Well, I want to reiterate my thanks to Supervisor Wattenberger that Ms. Era offered, because this is something I think it said October of '05 that Mendocino County stepped up and really took over this function, the Area Agency on Aging, and took over a lot of functions that quite honestly weren't running all that well. And so Supervisor Wattenberger stepped up and committed time to be the Mendocino County advocate. And Susan, I want to thank you and also to the agency for your leadership, because you've really taken this on, and I think you've grown the function of this and expanded it with the grants, and are really trying to zero in on the true needs of seniors, such as the fall issue. And I spoke recently with our Senate senior that we have, that I believe Supervisor Wattenberger recommended for approval, that goes to the senior Senate, and he's from the coast, from the 4th District, and he's been very excited about the additional things that the Meals on Wheels program can do, and the suicide prevention component of that, and how that can be used to really because you have access to seniors in their homes, and they count on those contacts in addition to the food. And I think there's many options there to sort of grow that contact in terms of the other needs that seniors have. So I want to thank you for your leadership, and also Supervisor Wattenberger. Thank you.
You're welcome. Thank you very much.
Thank you, Supervisor, for your comments. Of all the committees, and this is to the public, being a member of the Board of Supervisors is not just showing up on Tuesdays. This is a 24, 7-day-a-week job that the chair has the perk of deciding how many committees each of the other board members sit on. So normally the chair has the fewest. I think I have 5 or 6. My colleagues have upwards of 24 committees or commissions that they sit on besides showing up on Tuesdays. This commission, the Area Agency on Aging, has been my favorite. It starts from a very selfish attitude, because we're all going to be there sooner or later. But it has been one of the most enjoyable committees, commissions, etc., that I've sat on. I was raised where you learned from your elders. And every meeting that I attend of the AAA, I learn things from my elders that are on that board, that are on the advisory panel. It truly is one of the most enjoyable ones that I sit on, if not the most enjoyable, and I've told Susan that before. Sometimes it's not easy. You have to make critical decisions in a shrinking